Welcome to MD Labs Toxicology Specimen Collection video. This video illustrates proper procedures for collection, requisitions, packaging, and transporting urine and swab specimens to MD Labs for analysis as part of a patient prescription monitoring program. The supplies you need for proper specimen collection and transport depends on how specimens will be submitted to MD Labs. The preferred method is using a vacutainer with either a standard collection cup and transfer straw or with a port cup, which has a pin built into the lid of the collection cup. An alternative method is using and submitting an oral fluid collection device sponge. As a last resort, you can submit the urine in the collection cup. However, this is not recommended, as the cups often spill during transport and create challenges for the lab. Depending on how you will be submitting the requisition to MD Labs, you will need to have the appropriate requisition supplies. The preferred method for submitting a requisition is using pre-printed account-specific, bar-coded toxicology requisition stickers with a chain of custody label. This is the simplest method for submitting a requisition. An alternative method is using the toxicology requisition form with chain of custody label at the bottom. And the third method is by using the eRec system via the MD Labs portal with a label printer. The other supplies you will need for safe and proper specimen collection and transport include gloves, plastic biohazard bag with absorbent pad, MD Labs liner bag, UPS or FedEx lab pack with a pre-affixed MD Labs return label. All of these items are provided free of charge by MD Labs. When handling urine specimens, you must follow standard guidelines and universal precautions for working with biohazardous materials. Use personal protective equipment, including gloves, eye protection, and a coat or gown to prevent exposure to blood-borne pathogens or other potentially infectious materials. When collecting urine, provide the patient with a sterile, sealed urine collection cup labeled with their name and date of birth. Provide the following verbal instructions to the patient on how to collect a midstream, clean-catch urine specimen. Go into the washroom and wash your hands with soap and water. Dry your hands with a paper towel. Remove the lid from the collection cup by unscrewing it counterclockwise. Pass a small amount of urine into the toilet. Pass urine into the collection cup until it is at least 1/4 full. Screw the lid back onto the collection cup until it clicks, and wash your hands with soap and water. Demonstrate to the patient how to properly close the lid of the collection cup by screwing the lid until it clicks. Then, direct the patient to the bathroom and instruct them to return the collection cup to you when they are done. When you get the collection cup back from the patient, check the temperature of the specimen by observing the side temperature rating on the collection cup and record it on the requisition sticker, the hard copy requisition form, or enter it into the eRec form. The sample is valid if any of the dots on the gauge turn green, and invalid if they all remain black. You will still send the sample to the lab, even if it is invalid. You will now transfer the urine to the vacutainer. If you are using a standard collection cup, insert the tip of the transfer straw into the urine specimen cup, making sure the tip is completely submerged. Push the vacutainer down and into the top of the transfer straw, holding it in position until the flow stops. Remove the vacutainer, leaving the straw in the cup. If you are using a port cup with the pin built into the lid of the collection cup, pull the sticker back from the lid, exposing the port opening. Push the vacutainer down and into the port opening, holding it in position until the flow stops. Remove the vacutainer. Check to make sure the urine reaches the minimum fill line noted on the vacutainer. If not, you will need to collect more urine from the patient. If there is enough urine, write the collection date and time using a 24-hour format, along with the patient's initials on the chain of custody label. Then, place the center of the chain of custody label over the top of the vacutainer and press down both sides to secure the label to the vacutainer. If this label is not affixed, the specimen may not be processable. You can now safely dispose of the urine, collection cup, and transfer straw if one was used. If you are using an oral fluid collection swab, make sure the patient has not had anything to eat or drink for at least 10 minutes prior to specimen collection. Instruct the patient not to chew the swab or talk during the collection. Have the patient open their mouth and move their tongue side to side to accumulate saliva in their mouth. Position the swab under the patient's tongue and have the patient close their mouth. Wait until the indicator turns blue, and then remove the collector from the patient's mouth. Using your thumb, uncap the transport tube, insert the collector into the transport tube, and replace the cap. Snap the cap firmly to ensure it is securely closed. Write the collection date and time using a 24-hour format, along with the patient's initials on the seal. Place the center of the specimen seal on top of the tube and press down both sides to secure the seal to the transport tube. If it is not possible to use a vacutainer or oral collection swab, although not a preferred method, the lab will accept specimens in a standard collection cup. Check to make sure the cup is at least 1/4 full. If not, you will need to collect more urine from the patient. If there is enough urine in the cup, make sure the lid is screwed down tightly before affixing the label over the lid. Turn the lid clockwise until you hear a click. It is common for patients to not tighten the specimen cup lids appropriately, which can result in untestable samples and damaged paperwork. Once the lid is securely tightened, write the collection date and time using a 24-hour format, along with the patient's initials on the chain of custody label. Then, place the center of the label over the top of the cup and press down both sides to secure the label to the cup. If this label is not affixed, the specimen may not be processable. You are now ready to complete the requisition. The preferred and easiest method is using the pre-printed account-specific, bar-coded toxicology requisition stickers. Since you already entered the temperature and affixed the chain of custody label, all you need to do is enter the collection date and time, collector's initials, and check that the medication list is included. Then affix this sticker to the printed lab order that came from the EMR/EHR system. Check to make sure the lab order includes patient demographics, insurance information, test being ordered, diagnostic codes, appropriate clinical notes, appropriate risk note. If the patient demographics information is not included on the lab order, you will need to have the patient's face sheet printed from the EMR/EHR system to submit with the specimen. If the insurance information is not on the lab order and not on the face sheet, you will need to make a copy of the patient's ID and insurance card to also submit with the specimen. The patient's medication list needs to be submitted with the specimen. Many times, this is included on the patient's face sheet. If you are using a printed requisition form, make sure all the yellow highlighted sections are filled out accurately and completely. All of this information is required in order to ensure the lab performs the right tests for the right patient, is able to provide all requested data to the provider, and is able to bill properly. If any of this information is missing, you will have to painstakingly find and provide this information later. Start by circling the name of the requested provider that is pre-printed at the top of the form. If there is no name pre-printed, then handwrite the provider's name and NPI number. Then enter all the information in the Patient Information section. Use the 24-hour clock format to record the time. Thus, 2 p.m. would be designated at 1400, and 3:30 p.m. would be designated at 1530. Make sure you check whether the temperature of the specimen was valid or invalid. If point-of-care test results are available, designate this in the upper right corner of the requisition form. Either check No Prescriptions Declared or check all the patient-declared prescriptions and handwrite those that are not listed. Record the date the last dose was taken. If the provider has established their own customized testing panel to be run on all patient specimens, check the standard urine or oral fluid toxicology testing panel box. Otherwise, check the testing panels being ordered. If an EIA screen is not being ordered, make sure that box is checked. If the provider's signature is on file, the provider does not need to sign the form. However, if their signature is not on file, then the provider needs to sign and date the form. The form is now complete. If you are using the e-requisition form, you first need to log into the provider's secure portal at mdlabs.safemedicaldata.com. To enter a requisition for a new patient, you click on the Requisition Entry tab. Click New Requisition, choose the collector's name, click New Patient, enter the patient demographics. Enter the insurance information and select whether the specimen temperature is between 90 and 100 degrees Fahrenheit. You will then enter the test codes by clicking on the magnifying glass, unchecking Common, clicking Find, and then selecting Standard or the individual specific panels, and click Submit Selection. You will then provide the prescribed medications by clicking on the magnifying glass, selecting all the appropriate medications, and then clicking Submit Selection. Then, make sure the correct specimen type is selected, urine or oral fluid. Click Print Label, and a window opens with a depiction of the label to be printed. Click on the printer icon. Change the destination to the label printer. Change the paper size to 2.4 inches. Then click Print. If you are entering a requisition for an existing patient, you click the Requisition Entry tab, click New Requisition, then click the magnifying glass to search for the existing patient. Once you find the patient, click Select to the left of the patient's name. You then complete the rest of the fields and print the label in the same manner. Now that the specimen is collected, the requisition is completed, and you have all the needed forms with the required information, including patient demographics, insurance information, and medication list. You are ready to pack up the specimen for shipment to the lab. Depending on your situation, these forms could include the lab order, the patient face sheet, a copy of the patient ID and insurance card, and the medication list. If you are using the preferred method of the requisition stickers, you simply fold up all the items, place them in the outer pouch of the biohazard bag, then place the specimen inside the biohazard bag and seal the bag. It is important that the paperwork be placed in a separate compartment from the specimen to protect the paperwork in case the specimen leaks. If you are using the printed requisition form, follow the same procedures, except you also include the top copy of the requisition form and place it, along with a patient face sheet indicating their identification and insurance information, in the outer pouch of the biohazard bag, separated from the specimen. If you entered the requisition using the eRec system through the portal, then you simply fold up all the forms, place them in the outer pouch of the biohazard bag, then place the specimen inside the biohazard bag so it is separated from the paperwork, and seal the bag. all the biohazard bags containing the specimens in the zip-locked section with the paperwork in the outer pouch from that day's collection are then placed into the MD Labs liner bag, which is then placed in the UPS or FedEx lab pack for transport to the laboratory. Place as many specimens as will fit into the MD Labs liner bag, and place as many MD Labs liner bags as will fit in the UPS or FedEx lab pack before shipping. Sending a single specimen at a time, while sometimes unavoidable, creates excessive shipping costs. Lab packs can be dropped at any UPS or FedEx location or drop box, or scheduled pickups can be arranged by calling UPS or FedEx. You can contact the lab to arrange regular pickups. Within 48 hours of receipt of the specimen at the laboratory, the ordering provider will receive the results either by fax, a secure link with their electronic medical records from MD Labs, or by going to mdlabs.safemedicaldata.com and logging into their secure portal. Reports are typically one page and feature the following: patient information, requesting provider, information on when the sample was collected and processed, results from the tests performed. MD Labs reports are designed to present the important information first, such as if unexpected drugs were found, or if expected drugs were not found. This will be indicated by a bold, capitalized, inconsistent designation at the top. Our reports feature the target analyte, whether it is present or not, and in what concentrations. Cutoff level is the lowest concentration level we will report as positive. Method refers to the type of testing performed, whether it was an EIA screen for drug class or a confirmatory test using LC-MS. You'll then notice typical detection times for the particular drug and the specimen type submitted. Below that are all the tests which were performed but showed unremarkable results. Every report we issue is reviewed by our toxicologists before being released. If anything about the specimen is otherwise remarkable, you will receive that information in the additional notes section at the bottom of the report. If you have any questions about the report, please contact the laboratory. To recap, remember to complete all the sections of the requisition form. Be sure the paperwork you submit with the specimen includes patient demographics and insurance information. And if you are submitting specimen cups, make sure they are closed securely before you ship them. Thank you for watching this training session on specimen collection and transport. If you have any questions, please email clientservices@mdlabs.com or call 775-391-5221. When results count, count on MD Labs.